Hi, everyone. Biohacking Blondes here. We're super excited today. We're here with Dr. Dominik Nischwitz, or Dr. Dom for short. We're very excited to have you. Dr. Dom is a world-renowned specialist in biological dentistry, holistic odontology, and ceramic implants. He is the current vice president of the ISMI, International Society for Metal-Free Implantology, whose mission is to help as many people as possible to experience optimal oral health without the use of metal-based treatments. Big. He trains traditional dentists in biological dentistry and believes that all health starts in the mouth. So we are so excited to have you here. We kind of feel like you're super famous. You've been on all like our favorite podcasts. So, so we're thrilled to have you here and welcome. So tell us a little bit about what inspired you to pursue biological dentistry.
Yeah, thank you guys, first of all, for having me. It's my honor to be your guest. So what inspired me, basically my own health issues very early on, kind of like led towards that way. So I was never really interested in becoming a dentist or anything. That just happened by accident. But during the whole dental school, it's basically the training to become a dentist is university, 5 years. And I was already on the journey to optimize my health, but I didn't really connect all the things. I was just very good with my hands. I like the craftsman part. But in the whole university, there was something was missing. And after university and residency, I wanted to become an oral surgeon. And I realized there's more to just dental repair. There's heavy metals that we use in dentistry. There are root canals. There are various other things that maybe our root sources for patients' overall health. And this was the fascinating part for me because I like the dental craft, but I didn't learn in university that you actually enter the body through the mouth, and that is like the entrance to the overall body, and there's more to it, and that we can actually help people getting or patients getting really healthy by starting in the mouth. So that's what I was discovering. And basically, because I did so much health optimization, what you would call it these days, for me personally 20 years ago already, because I had to. I basically was able to fix myself. And then I had the moral obligation to learn more and go deep, and went into all the rabbit holes, became a naturopathic doctor. I did so many extracurricular things to just learn how overall health really works. And these, like now, 15 years later, we have a complete concept that we call Biodentistry 3.0, where I'm teaching the real biodentists because it's needed. And my mission is to help as many people out there, help them to reach optimal health by starting in the mouth, and obviously bringing this to the table in the whole realm of optimization, overall health optimization.
Love.
Yeah, that's amazing. I mean,
Quickly.
that's so inspiring. So for a lot of our listeners out there, they are biohackers. They've gone and they're doing all the photobiomodulation, the PEMFing, and the oxygen, and all of the above, taking all the supplementation, but they're still not feeling 100%, right? So can you tell us a little bit about like, what and why? What can be the costs that you can see, and what would you do about it?
What would be the cause?
Yeah, like what would you look at? So how does it start for you? And
so this is exactly where this perfectly fits in, especially for biohackers and health optimization. When you already try everything to feel superhuman, but you don't, then at least it's, in my opinion, time to look into the entrance of your body, which is your mouth, and see if there's maybe anything lurking that you don't even know about. And this is why I usually ask 3 questions to the audience on every single keynote is, like, if you already optimized, do you still have metal in your mouth or had metal in your mouth? So if yes, stand up and remain standing. And second question, there's no particular order, but it would be, have you had or have a root canal treated tooth? Yes, stand up. And the third question is, did they take out your wisdom teeth while you were growing up? And by that question, usually, maybe even you listening in are standing up.
Yeah.
On the Health Optimization Summit in London, 90% of all people stand up. On my dental congresses, 90% of all the people stand up, because dental repair is so big. And I think at least 80% of all of us had their wisdom teeth removed, for example. And this is why at the end, there's something we find that we can optimize. And this is foundation, because your teeth and your mouth is an extension of your brain. And as you guys know, chronic inflammation is chronic stress, which is killer number one. And this bit you cannot biohack yourself. So that is an ongoing silent trigger, and you probably don't even know about it, because your dentist, the normal ones, they won't tell you, because for them it's all about repairing, drilling, filling, and maybe later billing, but not about the overall health. And I'm not saying it bad. I mean, I love my colleagues, but that's how we are trained. We're trained garage, and maybe give you a nice smile, but fixing the bite and you pain, obviously, and make you smile. But we can make you smile and have nice, beautiful white teeth. But if you look on a cone beam or like a panoramic X-ray, is all dead underneath. It's like, this is something you maybe don't even know as a patient or as a listener.
No, it's amazing.
Yeah.
I was just going to ask, like, so the first time I ever heard about biological dentistry was I went to actually an event in West Palm where Dr. Rao was speaking. He's the Swiss.
I know him.
You know him? Oh, great. Yeah, he's amazing.
I actually 10 years ago, I did all the surgeries in his clinic as a flying implantologist.
Wow.
I did the ceramic implants for his patients, only for a short period of time, like 1 years, but yeah, I know him.
Great. That's amazing. Yeah. So that's where I first heard about it, because he gave a talk telling us.
Go on. Sorry.
Oh, sorry. Yeah, you froze for a second, but you're good. Yeah, he gave a talk about all of the the chart that he pulls up, which shows the connection between your teeth and all of the organs in the body. And I remember in that moment, this was maybe like 6 years ago, I remember being like, what? Like, what? Like all of these, and he does cancer treatment, right? He sees people who are like stage 4 cancer. They come to his place, and the first thing he does is he sends them to you, right, to have their mouths fixed. And so I just thought that was fascinating. Can you talk a little bit about that chart and how that works?
Yeah, so basically the chart is a meridian chart. It's kind of like how your teeth are connected with your autonomic nervous system. I mean, in medical world, if you pull out this chart, you're usually in the woo-woo category. Yeah, so it's nothing you learn in university, but still, like every single tooth is directly connected to a specific organ, which doesn't mean that it's completely correlated always. But for example, your incisors in the middle are directly connected to your kidney, bladder, meridian system. Your lower molar, for example, is directly connected to your large intestine. And your wisdom teeth, for example, are connected to your heart and small intestinal meridian. And this is why I asked the question, because a lot of patients have problem with their intestines, SIBO, small intestine issues, skin issues, thyroid issues, and the usual suspects, like autoimmune disease. And this is why we have to understand the mouth is part of the body and is actually very important for the body, because it is the brain. If you look at an anatomical chart, you have the brain nerve number 5, or the cranial nerve number 5, called trigeminus, and it has 3 branches like this. And at the end of the branch, so it starts in the brainstem, but on the technician, or as a dentist, on or in your teeth, will be directly going backwards through that nerve into your nervous system, into the hypothalamus, into the ganglia, and can cause problems overall. I'm not saying that this is the root source of all evil, but I'm saying it is foundation of overall health optimization. And luckily, finally, this year, for example, Andrew Huberman put it in his list of the 7 or 8 health foundational pillars of health. Peter Attia is finally talking about it. Even I saw the biohacker Brian Johnson talking about oral health. So oral health finally comes on the map. I mean, I'm doing this for almost 2 decades, but I'm very happy that now it's going to be heard, even though it maybe starts with biohackers or health optimization, but it will be very good to help people reach optimal health, because chronic disease is the epidemic of the 21st century, and often it starts in the womb.
It's a mess. It's a mess. That's why we're here. We're here to spread the message, like you. We're here to spread the message of, other methods that, they don't tell you. That no one told me. No one told me when I was sick. Yeah. You know what I mean?
What about you? You're healthy now?
I am super Viking right now. Oh, I am
Yes.
great.
Alex,
I
Alex,
referred.
you have to tell him your story about your teeth, like your teeth,
Okay, so
your
you
journey
just
of
gotta
your
hear.
teeth.
Okay, so Dr. Dome, how I destroyed my health. In my 20s, I moved from Sweden to London, and everything holistic went out the window, right? And anything or everything that mattered to me was how I looked on the outside. So it was long hair extensions, big lips, you know, the fillers, I mean, the whole thing. And then I jet setted and partied basically around the world, right? And the only thing that mattered was also how skinny I was. So I ran for like 2 hours a day, and I lived on coffee, Red Bull, slimming pills, and sugar. Okay. I didn't want to eat because the stomach was like an 8-pack, right? It should just like be
Yeah,
like this. Okay. You get the picture. And at one
I
point,
get it.
so I met my husband when I was 26, and he's like, what is going on here? So for years, I've been doing this. I was sucking lollipops, so Chupa Chups. Have you heard of
Yeah,
those? Chup
of course,
lollipops?
of
Okay,
course.
so I was sucking Chupa Chup lollipops because with that, I would then drink like a lot of water, and it was kind of the sweet, right? And it kind of took a while. I mean, it's like all sick, right? It's like anorexically stupid sick. But long story short, I went to the dentist one time, and I was newly dating my husband, and I came back and I was crying, and he's like, what's the matter? He's like, I said, I've got 9 decays. I had 9 decays in one go. Okay.
Yeah.
And that was it. He said, I think it's enough now. And the lollipop, the Chupa Chup would rest on my nightstand, basically. It was the first thing I did in the morning and the last thing I did at night.
Oh,
Nightmare.
wow.
Okay? No,
Yeah.
it's very, very, so you can imagine, right? So I I don't have the amalgam, but I have one root canal, and then I have one implant. Okay.
Titanium.
A titanium implant. You are for ceramic, right?
Yeah, I'm only doing ceramic implants, but titanium is the one that usually the dentists do. That's still the gold standard.
Okay. Okay.
But it's a
So
metal. That's why I'm assuming you have a titanium.
yes, it's a titanium. That's what I have. But long story short, but what I know from you, and I think what the listeners really want to know is the root canal. This is a big problem, right? And why is that? And I think that's my problem, perhaps.
And the titanium implant.
Oh,
So,
and the titanium.
yeah,
Okay.
yeah.
Oh,
Because
okay.
it's a metal. Again, like,
Okay.
and you had your wisdom teeth are in there. They're not removed.
The 1 or 2 is removed.
So you have a yes to all 3 questions. So basically, you
Right.
would stand up. Yeah. So first of all, root canals are a fine art that we need in dentistry because we want to get you out of pain. So if you had tooth decay, that's not on the dentist, that's on you, and it went to the nerve, we kind of have to take it out so you can keep the tooth for biting. But the tooth then becomes devitalized, so it's not alive anymore. No more blood supply, no more lymph supply, no autonomic nervous system. And you just basically fill it up with plastic, to say it in simple terms. Not correct, but roundabout. And then it works. For biting, you can totally bite on it. However, it's only a matter of time if this tooth that has no more immune system becomes reinfected with bacteria that now perfectly live in the caves. So I'm always referring to it as like the cat and mouse principle. You have like the mouse being the bugs living inside the dentin tubules of that tooth. And then your immune system, the innate immune system with the macrophages, attacking it from the outside, building a cyst, for example, or a chronic infection. So if you have chronic inflammation, so if you have any immune system left over in your body and there are bugs, your immune system will be there to make an inflammation. That's just how it works. Infection becomes chronic. And therefore, it can be a huge trigger for your nervous system, for your immune system, for your hormonal system, for your overall health. And then we also obviously would look, which one is it? Like, what tooth is it? Do you remember which one your root canal is?
No, I got to go back. I send you a message. What it is. I can't remember.
So what I would do for patient is just go to your dentist and get a 2-dimensional panoramic x-ray. That's just an overview. Send me this one and I can tell you.
Okay.
So we'll also have a look at your titanium implant because it's almost the same problem, the same chronic inflammation that happens with a root canal, that is cytokines. I mean, Molly will probably also know cytokines such as TNF-alpha, IL-6, NF-kappa B, interleukin beta and stuff. They will be chronically raised and causing issues systemically. So And on top, a titanium implant is also a metal, meaning in this world, it's going to be an antenna because there's EMFs all around. So
Wow.
this titanium implant is the same thing as a root canal, a little bit different, but another trigger for chronic inflammation. And you can also become allergic to it. Or let's say not allergic, sensitive to it, because these particles, titanium dioxide particles, go into the local bone, and then your macrophages again cause inflammation. So they found them up to all the lymph nodes. It's just, I mean, it works for biting again,
Right.
and it's maybe the gold standard, but it's when it comes to how can we optimize you, what is the next level? There are better solutions nowadays. I mean, there wasn't 20 years ago, but now we have ceramic implants. And at least in Germany, finally, since last year, there are medical guidelines. So now
Right.
I'm good now because I wrote the book more than 5 years ago, when I was a little bit too early for the average dentist. But now it's standard, so it's coming.
That's amazing. Well, what
That's
would you
amazing.
say? Like, we have friends who are dentists who live in town and, you know, all over the place. What would, like, I'm trying to imagine what, if they were listening to this podcast, would their mind just be like exploding? Like, what, what do you say to other dentists who don't know about what you teach?
So basically, biological dentistry, for example, the one our system is called Biodentistry 3.0 because it's the next level of all the things. Because biological dentistry, you can't really there's no standards for it. So I had to create a standard.
Yeah.
And the 3.0 concept means it's the melting of the high-tech craftsmanship with only biomaterials with functional medicine and health optimization or biohacking to help that overall body. That's what we do. And if these dentists that are listening in, or your friends, are somewhat open-minded and skeptical, they can be skeptical, I'm that too, then they should come and learn from me, for example, and get their certification, because it's not against conventional dentistry. It is just the dental evolution. It's the next level. If they get if you show them this podcast and they get emotional about it, you know it's not the right way for them, because they're stuck in their thinking and they're not open. They're not in an abundance mindset.
Correct.
Yeah. Then it does. But if they are skeptical medical doctors, that's the perfect start.
Yeah.
I'm skeptical too. So I'm always questioning everything. That's how I came up with these concepts, because even in university, I was already questioning everything, because I learned so much about optimal health and nutrition and supplementation and functional medicine already during my studies in dentistry for me personally, back in the day already. So I was questioning all of it.
Yeah.
Wow. So when people come to you as a patient, Dr. Dome, what does it look like? What do you start with? And then how do you build the protocols? And how do you incorporate biohacking into that?
Yes. So most patients actually fly in. There's a lot of patients coming from Scandinavia, probably even more from the US is probably the most. And therefore we have it all set up in a way that we ask for that panoramic X-ray at the beginning. So we have a rough overview. Are there metals, root canals, cavitations, something we didn't even touch? And then we would send a preliminary treatment plan to our patients. So this is what we're going to propose to you, how to optimize you. And then our system works with, you fly in for a week, let's say a health optimization week, where we will repair all the repair that has been done in a more biocompatible way, meaning we take out all the root canals, place ceramic implants, we take out all the metals, even the titanium implants, and restore that more biocompatible, and also take care of these chronic jawbone inflammations called cavitations in layman's term. And in order to do this, we also prepare them beforehand, let's say 4 to 6 weeks prior, with the right nutrition. That's the food design concept, and the bone healing protocol. Because when they arrive in the clinic, they should be already in an anabolic healing mode, like prepared for any kind of things. And then when they're in our clinic, we also have an optimal health lounge right next to the clinic, where we do hyperbaric, IV, red light. We have everything you were just introducing yourself towards. That's in our optimal health lounge. Everything,
Amazing.
like even hypoxia training. Even laser in your veins, like low level photobiomodulation, low level laser therapy intravenously. We do it all just to support your body in your healing capacity, because that's what it's all about. And then obviously teach our patients how to live the right lifestyle for the next 3 to 4 months to really build bone and tissue and all these things. So that really helps. And the goal is obviously then when they come back, give them nice, beautiful teeth, health, and then aesthetics. But then after this is finished, I never want to see you again as a dental patient, but you can come in for health optimization. So that's the one thing. That's why it's quite charming, because we do all these appointments in just 1 week. That's why it's probably very like interesting for all these patients to fly in. And it's obviously also great time over there.
Yeah, that's so cool. You can go in for all of your dental work, and then you can continue to just come to you for optimization. Like, let me go in the red bed and let me try that. Yeah, that's awesome.
It's all planned. Like they come in and then they have a lot of treatments in the lounge, and then the surgery or the dental part is kind of like just, it comes with it. So it's not really the biggest focus. It's more like, how can we balance out your immune system and your body so that the surgery or the dental procedures just work beautifully. And my goal is always, if possible, so that you don't even have any pain or any swelling. I mean, I cannot guarantee, but the way we do things, we quite minimize it.
Wow.
And do you do blood work too? Do you do like blood work before people come in and see
Yeah, definitely
how they're doing? Yeah.
So for standardization, we only ask for a handful, especially vitamin D3, because we want to know how like deficient they are, because vitamin D3 is actually critical for bone healing and tooth decay and stuff. So that would be asked. I mean, patients oftentimes have more. And then we do a lot of testings while they're here. Not necessarily all blood work. We can do it all. It's all there. But we do a couple of scans, like also full body composition scans to see how their body composition is representing, for example. But also we have a scanner that is called Global Diagnostics. It's kind of like, it has, let's say it has just 1 million of frequencies. Like every single thing in nature is frequencies.
Yeah,
it's
of
like
course.
every bug has a specific frequency. Every supplement has a frequency, every food, right?
Yep.
And this machine has all the frequencies and just tests it against you within 8 minutes, and you know exactly how your levels are right now. And we just collect all the data to see what will happen with our nutritional interventions, with the bone healing protocol, with the surgery, with the removal of the metals, and the new lifestyle and nutrition. What will happen within the next 3 months? Like status quo, and then a lot of data points. Because usually the side effect of doing the whole thing is we heal from here, like from your mouth to your rectum, within that 3 to 4 months, because patients, because of the surgery, we have a huge incentive for patients to change their complete lifestyle. So as a side effect, they have a complete new gut system and lost 20 kilograms of body fat, for example. And this is what I love to do, right?
Yeah, of course, how rewarding. That's amazing. And you see this.
It's fulfilling if you can help patients overall.
Oh yeah. And they come to you for like teeth decay, and then you're helping them with like whatever else is bothering them.
I mean, to be fair, I'm in a bubble. Patients come for us from all over the world to help. They know it's going to affect the overall health. Yeah. So the focus is, I mean, of course, they have the focus of having that to be repaired, but it's more like, oh, I have seen 29 doctors before, and I couldn't resolve my rheumatoid arthritis. I couldn't resolve my depression. I couldn't resolve this, and this. But now it's 80% better. And at the end, I also had nice teeth. So that would be the change of focus for the dentist.
Yeah.
The aesthetics is just, that is just the standard for us. That's just cosmetic dentistry. Cosmetic dentistry is actually the most high-tech dentistry. So it's natural to be like in that biodentistry 3.0 concept, because this is also for dentists that are listening in. Holistic dentistry in Germany or in the US had a very bad rep. Most good doctors that are good skilled dentists will initially just say, oh, then they're not good craftsmen. They just don't know. They will use like a ringing bell or whatever to do, because they're not good with their hands. So that's why I had to change the labeling, and we just upgrade. We do, of course, the high-tech dentistry part on the highest level, but help the overall body to heal itself by starting in the mouth. I mean,
right.
Why not?
Right, of course. And this is such a, for many people, they, the majority of people, they see the mouth here, they go to a dentist, this is cut off from the rest of the body, right? They don't see the connection. This is
obviously also how we are trained in dental school.
Right, of course.
Yeah.
Of course. So this message needs to come out for sure, right?
I mean, there are open-minded dentists, and I'm teaching for over a decade, and finally I have a online training, and right today or last 3 days I had one of the real biodentists. I call them the real biodentists, the real bees. Yeah. The one from Canada, because you just said you're from Canada originally.
Yeah.
The only one in Canada was just here for 3 days of shadowing for his level 2 practice. So it's a cool, I don't want to call it tribe because it seems limited, but it's a cool crew of new like-minded people. I'm having a good time, they're having a good time. And we just live in a co-elevation space where we all bring next level stuff to the table. And this is also for all the dentists out there. I'm not out there for competition. I just want to help as much people as possible, like you guys want to do, and then co-elevate and make something big together, because it's about patients, helping them heal, and they're suffering, right?
Right. That's
Absolutely.
exactly right. That's exactly right. That's what
I
we're
wanna,
here. Yeah.
I want to ask a little, like every time I go to the dentist, they tell me I have very strong teeth, like very hard teeth, which is good, right? Because then you're not getting, I've never had a cavity my whole life. I never had braces. I've never had a cavity, never had a root canal, none of that. However, they told me that if I didn't take my wisdom teeth out, that all my teeth would crowd. So is that true? Is like, can you live with your wisdom teeth and not have your teeth get crowded?
So theologically, in the ideal world, your nature is not stupid. Like, you're designed to have space for a set of wisdom teeth, right? It's 32 teeth. And if you have space for your wisdom teeth, please keep them in your mouth, because it's a perfect, healthy organ. Unfortunately, in the Western world, 80% of us are grown too narrow. That's the lifestyle, that's all these pieces. And because you're growing too narrow, dentists or dental surgeons just take out your wisdom teeth. And especially because they maybe see already you need braces, so they take it out because you don't want to have crowded teeth after your braces, and maybe not even necessary. But maybe it is necessary. So I'm not saying that wisdom tooth removal is in itself bad. The problem is just we need to go more back to our ancestral roots to find the root source of the problem.
Right.
Which starts obviously already in the womb. 15 years old, and you already see, oh, there's no space. Then the dentist has the only option, like, oh, we need to remove your wisdom tooth. But it should only be done by preparing that patient systemically, so the patient is in a healing mode. But the only thing a dentist usually does is gives you consent for. You will have swollen cheeks, you will have a lot of pain, you will need painkillers and antibiotics, and you're off school for a week. That's basically it. But there was no preparation. And the problem that happens within the next years is you never heal. And this leads to something called cavitations in layman's term. It's a chronic silent inflammation in the jawbone that stems from previous dental, or let's say previous tooth removal that wasn't healed, that didn't heal. And the problem here again comes is this is something, cavitations, that you don't learn in university. So dentists don't even know about it. And patients maybe suffer from an autoimmune condition from their wisdom tooth surgery 15 years ago.
Wow.
I mean, that's how big it is. Like have you had your wisdom teeth removed, Molly?
Yeah, I had them removed.
Oh, you did it? Oh, yeah.
Yeah, no, I did. I mean, I was in my low 20s when I did it, but looking back at it, I'm like, I don't know why I did that. Like I really didn't have a problem. They just kept telling me, oh, well, if you don't remove them, they're gonna, your teeth are gonna crowd. So
were they already growing out? As like they were grown out? You had space?
I think so. I think so. Unless, no, maybe they were impacted. I don't know. I actually can't remember. It's hard to say.
Yeah, but anyways, I don't know how it was in your early 20s. So to be fair, doing this in your early 20s is probably better than doing it in your teenage years, because that's when we usually do it.
Yeah.
And this is when you're growing. When you're growing, you don't want to traumatize the body in its healing capacity, because your body will prioritize growth, not that trauma here, unless you really prepare the body, which dentists don't do. They don't know about it. And I'm not saying this in a bad way about dentists. I didn't know about that too. So it's just new levels of learning. But I'm assuming, I don't know how old are you now, but let's say in your 20s, you maybe not have been on the perfect health diet, and maybe had some deficiencies, maybe in your studies, drinking, partying like I did. So it probably didn't heal. So I would order, when you come, I would then probably do a 3-dimensional x-ray for sure when you're here. And in 90% of all cases, or I would say with above 90%, you will probably have these cavitations, which is only layman's term for something called fatty degenerative osteonecrotic jawbone, FDOJ. And this could be a ongoing trigger that disrupts your sleep, that gives you a frozen shoulder, that gives you a thyroid issue, that gives you hormonal imbalances. All of
SIBO and
that
small
issues.
intestine issues are my issues, which you had just
What I
said.
just said at the
Yeah.
beginning, right?
Right.
Yeah.
And you can't fix it with your diet, right?
Oh.
Even though you're a nutritionist.
And I literally, I know I've low FODMAP. I do the whole, I've literally learned everything. I've been on the rifaximin. I've done that whole path. I've done the whole, like everything.
Yeah, so you did it all, even rifaximin. So this is me personally, this is kind of like me 10, 12 years ago, same as you, everything done, right nutrition, still skin eczema, still nervous and stuff. And then we found my cavitations and I basically healed overnight after doing surgery. Like skin is perfect. I have no more high cortisol, like super high cortisol.
Insane.
My whole
God, I
gut
need to
issue
come see you.
resolved afterwards.
Yeah.
Oh, we're
of course.
coming. We're coming tomorrow.
Yeah.
You will
Flying
definitely
from
come.
Central Pay to you.
Everyone is coming these days. Like a lot of my friends, even Sean Wells was here lately. I don't know if you follow him.
Of course, I met him. Yeah, we met him.
He documented his whole health journey. So probably going to be a nice YouTube video. Chris Gethin is one of my best friends. He came here. Tim Gray was here. Like everyone is basically here for.
Amazing.
Yeah, that's how we build it, and I'm happy to have you guys. So please get your panoramic X-rays and send it over on WhatsApp, and then chat about it.
So Dr. Dome, one of my really good friends that when we lived in London, she was my dentist, is Sandra Garcia Martin.
I know Sandra.
I know you know Sandra.
I only know her. I think I only know her through Zoom, like you guys, but I know her definitely.
She's beautiful. She's beautiful. She works on Holly Street and she's amazing. I'm seeing her when I get back to London on Sunday.
Is she also working on an island sometimes? Or did she?
Yeah,
then I know exactly where you're talking to.
Tenerife. Yeah, she's gorgeous and she's into working out.
I'm not so good with names, but I'm very good with faces. So if I see her face, I know exactly who it is.
Oh yeah, you totally know who she is.
You send it over already. I know.
Yeah. So another question. So we, the wisdom tooth is very informational because we have a lot of parents that are listening to this podcast. So a lot of moms and dads, especially moms with kids. So I think this is really important information what you said, because the dentists say, yeah, we got to remove, right? No, hang on, right? That's what you are urging parents to say, correct? Double question the dentist. Why are we removing the wisdom tooth? Right?
Exactly. And maybe if you're listening in and you're at the right timing, if your kid is only like, let's say 8 years old right now, then we have possibilities to work with myofascial training, with craniosacral structures, and with appliances, and then nutrition and everything to widen the jaw still while you're growing, and you don't need any braces later, any surgeries. But of course, it's a timely, sensitive thing. So if you have kids that already had their wisdom teeth removed, or you have the caul needs to be removed, then you at least need to prepare your kids with the right nutrition, right lifestyle. But also, if your parents out there and of new parents or parents to be, and you can't get pregnant, because this is a big thing that I'm having an issue with patients. Like I think maybe you too, Molly, one out of 5 couples these days in the Western world having a hard time to conceive. All doing the in vitro, they're trying everything they can. And I have a reputation for helping women getting pregnant.
That's a nice side effect.
You know how I say it, like, I even have one of my patients, even a great gynecologist and a functional medicine practitioner from the US. And she sent me a message after I took out her, I think she had cavitations and one root canal. She couldn't get pregnant. 2 weeks after surgery, she's pregnant or conceived. And she said in the message, I'm blaming this all on you, Dr. Dome. I have a couple, two handfuls of women that come to my mind straight away because they tried so hard. And then it was so simple at the end. The body just needed the relief of getting into a parasympathetic yin state to conceive. But because of that ongoing stress in the mouth, they kind of were like in fight and flight constantly and tried everything, didn't know it's from the mouth. That's that's all what I want to give. Like you did everything already. Are you trying? You're not there yet. Check out your panoramic X-ray, find a biological dentist, the right ones, obviously, that are trained. And then maybe that's the splinter we will need to remove, and you suddenly heal and your body is able to balance it out and get pregnant.
Yeah.
That's so amazing. Can you talk a little bit about, this is kind of again off script, but like sparkling water in the terms of like Pellegrino and stuff like that, and what it does to kind of, does it recede your teeth? Like, does it, the
Gum
gums?
receding?
Yeah.
So no, gum receding is more like, so underneath your gums is a bony structure. So your teeth are sticking in a bone called the socket. And as if you lose bone, then the gum recede with the bone. So it's the bone structure underneath. That's usually a sign of chronic depletion of nutrients, chronic stress, chronic inflammation, lots of bleeding gums, periodontitis. It's not because of the carbonated drinks. So the carbonated drinks would be more like dental erosion, meaning like maybe your tooth enamel gets a little bit more soft. I mean, there's carbon dioxide in bubbly water, and it is kind of acidic, but it's not as bad as like drinking soda or juices. Like juices have a very high acidity. So our mouth has a saliva, right? The saliva has a specific pH level. Women, funny enough, or like maybe it's interesting for you guys, women's oral pH changes with your cycle. So it's not as consistent as men's pH. So our pH is around about 7.4, and quite stable. Yours, I don't know in what phase of your cycle, goes sometimes even to 5.5. That means in that phase, your teeth are getting more demineralized. And that is the entrance to tooth decay. So you need to be more aware of your mineralization, of vitamin D3, of all these things. And then in this phases of all the sodas and all the more, let's say, acidic things, maybe even you notice that at some days during your cycle, you're more sensitive on your teeth when you drink a coffee versus in others not. That's exactly what you feel, because coffee, for example, is very highly acidic. And highly acidic, again, it's dose dependent. You can drink your coffee if your body is in a state of balance and can remineralize, then it's not a problem. But if you're always on the side of demineralization, you lose your tooth enamel. You're just getting decay. That's what you did with the lollipops, with drinking the sweet stuff and not supporting your nutrition, probably not sleeping, partying, doing all that things. Yeah.
All of the above. It was fun.
Fine.
It was fun.
It was fun, and it's completely fine. You learn that. And I mean, I wasn't doing the same as you, but I basically had a lot of fun too. That's why I crashed with my health very early on. Like I was doing a lot of partying, a lot of I just had fun like you. Lots of drinking, smoked cigarettes a ton, skateboarding. In my teens, like I started very, very young, like with 14 years old to drink, and then I crashed with 21 with mental health issues. And that's when I had to learn how to optimize me, because that's 20 years ago, and there was no YouTube, no functional medicine, no Dr. Google, no one could help you. It's just like, oh, you have mental health issues, you're kind of like gone. And I didn't believe it. I just felt I want to be normal again and have fun. And that's why it took me so long. And now I learned all these things, and I like to give it back, because so many people out there are suffering exactly from this. And it's good to have fun. I don't say anything against it.
Yeah.
I always say if you can't have fun sober, then what are you doing anyway?
Right.
You should be able to have fun and just without having to all these extra things, and so yeah. we're totally into that. But I always noticed, like, I was on vacation recently, and I just my stomach was hurting, and so I got a ginger ale, but of course there's sugar in ginger ale, and I remember for the first time I hadn't had one in so long, I felt my teeth like fuzzy. They felt like fuzzy after drinking it. Yeah. And that's just, it's decaying, or what is that? Is the sugar?
No, that's probably just acidity and the sugar, and also maybe because you're only eating cleaner foods, I assume. Yeah. You also, from that sugar thing, you get like a biofilm on your teeth within a second. Feels like a little bit of a fur on your teeth. So it's acidity, a little bit of demineralization, but it usually, if you're healthy, usually within 30 minutes, 45 minutes, it's back to normal, because that's the capacity of the saliva to balance it. It's called remineralization. The other thing is demineralization. So, but if you have enough magnesium and all the stuff in your nutrition, not a problem to drink a ginger ale. But if you drink like 3 liters of ginger ale a day, it's a problem. And that's what I did as a kid. Still have tooth decay.
Same. No, absolutely. So I think everyone is super interested in hearing your routine. Okay, what is your like no for teeth? Like, what is your number one hack? Like, how does your day look like? How are you superhuman? Why do you look so good? Why are you so energetic? You know, like, what are you doing? You know, what is your secret here? Can you give us a little tips here for the listeners?
Thank you.
Carrots?
I
Yes?
mean, I'm a dad too. I have 4 kids.
4.
Four, yeah. I try to live by example, practice what I preach. So I basically wake up at 5:30-ish, 5 to 5:30, do a little mobility and hydration, and then I go straight to the gym and work out because that's my kind of, for me, this is meditation. I need sport to go get grounded.
Yeah.
I have a ton of energy. That's just my nature. I have probably too much. So this balances me out and I'm actually more energetic or more balanced afterwards. And then when I come home, basically my kids are there, I'll cook the breakfast. And my nutrition is very, let's say, dialed in. So I'm only eating real food, preparing that for the day. So I'm eating a lot of food, but only healthy food. So just this in itself and the consistency obviously leads to strong teeth. I don't have any tooth decay. I had my wisdom teeth pulled, so I had the cavitation experience. I had no tooth decay. I don't even need to brush my teeth. I still brush my teeth, no worries. I don't need to, no. I don't even use a floss, nothing. No Listerine, no mouthwashes. It's not necessary. If your lifestyle is kind of supportive what you do to how you should live your life or to nature, not necessary. But I'm saying this with respect to that most people are not there yet, or there's not even their interest. And then I try to, maybe this is also because of my training, I'm very balanced, even though I'm obviously doing a lot and very structured. Otherwise, I wouldn't be able to juggle. I mean, I have a clinic. I have the Optimal Health Lounge is a separate thing. I have a supplement company for over a decade. I have a second supplement company. Yeah, my supplement company. I actually had my supplement company before I even started my clinic. It's called Substance Nutrition. Yeah, we never really talked about it because I was mainly training dentists how to use them, because this is a different approach to supplementation. It's all super clean, all formulated by myself.
Wow.
And wow, where do you make your supplements? What are they? I mean, tell us more.
I mean, Substance Nutrition is in Europe. It's in Germany mainly, but because of me, my main audience is actually the US. So we just right now, we're launching a new supplement company for the US market. It's called Supreme Oral Health. And it comes out, I think within the next, let's say in October 2024, it will come out with Tooth Shield, the first product, which is basically your one-stop shop for hard teeth. Hard as granite. Your teeth naturally are immune against tooth decay. But if the lifestyle doesn't fit and you deplete it, they get weak. If you drink smoothies all day long, which is soft food, they don't get chewing anymore, they get weak. So we just need brushing maybe. We can go into that too. But also we need the right nutrients. And therefore, this is the first one to come out. But in Germany, I have the whole bone healing protocol. The supplement company in Germany started from a different perspective. I was the nitty-gritty dental specialist for biodentistry and ceramic implants. So I was focused on bone healing and how to make sure that the body is in an anabolic state to heal that bone. And therefore, I created all the supplements, which were grown into a complete health matrix. But this is how this one developed. And now we can come in with other things. And then obviously I have the biodentistry training. So it's like a lot of different islands to myself, Dr. Dome, that we're aligning right now. But at the same time, I want to be in the present with my family. I mean, I have a wife, 4 kids, 3 boys, 1 girl, if you want to know more. And I have 40, like around about 20 people in the clinic. I think it's about 40 people in my staff all over. So lots of teams, and I'm just having fun. I'm like a kid. I like to play. I like to build things, create things, and then build the next thing.
Well, this is your passion, so it doesn't feel like work. This is your passion, and you're spreading the message and the love, and this is so it doesn't feel like work.
Yeah, maybe it comes across that this is really my sole mission. I'm on that. And this is why
100%.
it's effortless. It feels effortless. The
Yep.
right things feel effortless. It just come
Yep.
through me. And
Yep.
also, it's not about me anyway. So I just want to be,
Yep.
I'm just the light tower for the movement. So yeah, that's cool. And then for like, let's say dental routine, for me personally, I also obviously, because it's the number 1 question I get asked is, what toothpaste do you recommend?
Yes.
Usually I don't recommend any toothpaste because the toothpaste we are using are mainly chemistry and designed, let's say 40 years ago, to sterilize everything in nuclear oral microbiome. But with all the research we're now having, that the mouth is a complete microbiome, the second largest actually, most diversified. Why do you want to disinfect all day long and use fluoride and triclosan and say, like, it's a mess. It's really a scam. So I obviously created a new toothpaste formula which launches soon in Europe, and I hope I can bring it to the US soon too. And this is obviously something you would eat, and therefore I can do it twice a day, and it's like a supplement, and it will make my teeth clean.
Oh, I love it. So in the car here, with the 3 girls, I'm like, we're gonna have Dr. Dome on our podcast, and they're like, okay, and they had no idea about any of what we've been talking about, and I said, what toothpaste are you guys using? Oh, Colgate.
Of course.
They're all using Colgate. They have no idea. These 3 girls have no idea out there. Okay, they're drinking champagne and eating chips right now. So they have no idea. So now I'm gonna go out and tell them afterwards. Okay, we got to stop those bad behaviors. All right.
Yeah, Colgate is normal.
Yeah.
If you go to oral health, I did that everywhere I go to the oral health. Oh yeah, did I freeze or was it you?
Yeah, no, you froze for a second.
Oh, I froze. I thought you froze. Oh, I'm sorry.
We were. Well, I don't know. You were freezing, but
it showed full connection, but I wasn't sure. Yeah, you can cut that out. So everywhere I go to globally, I will always check out the oral healthcare section, and it's all the same. Like you said, there's Colgate, there's Oral-B, there's Sensodyne, and there's Listerine in every single color. Like we have blue, we have green, we have brown.
And there's like shelves of it.
Yeah, like shelves of it. Even in the US, I did it. I was on a quest in California to find a natural toothpaste in a supermarket that was clean of all the toxins. And I finally found one at Sprouts, but it was lacking active ingredients. So most of the natural toothpaste that don't contain fluoride, and they were quite good designed, they had essential oils and whatever, but they had no active thing. And some people actually need active ingredients. And the alternative to fluoride is called hydroxyapatite. And I wasn't able to find it in a store. You can get it online. I have so many. If you go on my Instagram and check the recent posts and reels about toothpaste, in the comments, I always ask everyone from everywhere, which one do you recommend? Because I don't know what's existing in the US or what is existing in Africa. So you will find it going through my comments.
Oh, I love that.
Hard. You cannot find it in a store. I couldn't find it, not in Whole Foods. In Sprouts, it was better, but not with active ingredients. Not possible.
So when you say active ingredients, what are you referring to? What do we want to see in a toothpaste?
Yeah, I mean, an active ingredient in the conventional toothpaste is the fluoride. Like every dentist will tell you, you need fluoride.
Yes.
Because it will make your teeth hard. And it's correct, kind of, because the sodium fluoride will go into your tooth, make it a bit more hard, but also more brittle. Because it's not a natural thing. I mean, we have, as you know, if you look into a water, we have calcium fluoride in nature. We drink that. But sodium fluoride we use in dentistry is a complete soluble toxin, and it's even a neurotoxin. So why would you use it if it comes with side effects? So the alternative would be hydroxyapatite, which is the same thing, but in a natural way without any side effects. So you wanted to see hydroxyapatite as an active ingredient. Then you don't want to see all the other chemicals such as triclosan, carrageenan, sodium lauryl sulfate. You don't want to see saccharin or sucralose in it, but instead you want to maybe see coconut oil and xylitol. That would be a great start, and we can go from there.
Yeah. My daughter uses the xylitol toothpaste and likes that. And I have the hydroxyapatite. There's one on Amazon called Boca for people who are interested. I think that it's okay. Yeah.
Perfect. This one I get recommended a lot in my comments.
It
Boca.
smells like-
I haven't tried it myself because I'm not from the US. And this one I couldn't find in a store.
No.
Online, yes. You can
Online.
find a
Yes,
Yeah.
yes. For some reason, there's
Exactly.
none of that in the stores. One time I saw like a charcoal toothpaste in the CVS, and I thought that was interesting because I hadn't seen that there before. What do you think of charcoal toothpaste?
charcoal toothpaste might be a good idea if the rest of it is clean. But the
Right.
charcoal toothpaste you usually find are just tooth whitening toothpaste that are the same toothpaste just with charcoal on top and maybe more abrasives.
Yeah.
Aiming to whiten your teeth. And what they do, they file down your enamel and you actually end up having more yellow teeth in the long run.
Oh,
Because
wow.
it ruins your enamel. Yeah, why? Just stay away from tooth whitening toothpaste. You can definitely have white teeth. I have nothing against it. You just need to have your minerals in check and vitamin D3. And then please go to see a specialist like a dental hygienist or a dentist that offers in-office bleaching or home office bleaching, but home bleaching. But the whitening strips and the whitening toothpaste are usually not a good idea.
Yeah. That's
Come
what
with side effects that you don't want to have.
As I pack those in my luggage, okay?
No.
I better ditch those. I was just gonna put a strip on after we hang up for tonight's dinner. I was gonna
don't do it.
extra white teeth. I use those.
I love it.
strips
I
from
love your
time to
mindset.
time.
So funny. Yeah, it's cool.
No, but those are not good then. They are not good idea, the tooth whitening strip. No.
Depends where you have them from, but in general, I wouldn't use them.
Okay.
In general, I mean, like I said, it's not a problem to have white teeth. I'm a fan of that.
Yeah.
But do it in a sustainable way. Go to a professionalist for that. Like usually the dentist knows how to do that at best.
Right.
But I mean, your teeth, both of your teeth look quite white, so I wouldn't see a problem here.
Well, they can always be wider, right?
Uh,
We live in America. We live in America.
I mean, the white teeth in America, the Hollywood ones.
It's terrible.
For me, as a European, it's
Oh,
just fake. It
Yeah.
looks so bad. I see it like they're too big.
By the way,
You remember Jim Carrey being that green guy, like the mask guy with the huge white teeth? That's how it looks for me. It's like complete wrong. I'm into the natural aesthetics. I like the natural. And then the natural one in white, like as white as humanly possible. Like, believe me, they will be very, very white. But they're not white as like the ceramic in a toilet. Like that's the wrong white.
That's a good
about, like sometimes dentists tell me like my daughter drinks a lot of lemon. She likes lemon water, and they say that can make your teeth yellow too. Is that because it's so acidic and it can?
Is she just diluting the lemon in water, or is she just drinking straight? No, that is not a problem at all. But if you drink fresh lemon squeezed, yes, that is super acidic. I mean, I love to drink like a little bit of apple cider vinegar in the morning with a tablespoon of lemon juice or squeezed lemon.
Yeah.
It's dose dependent. If I would do that all day long, it's probably not so good for my teeth. But if you drink all day long, just let's say 1 lemon in a liter of water, I don't think it's any problem for you.
Okay.
It's actually alkalizing to the body.
Yes.
Even though it's acidic, but because it's so much dilution in it, it's fine.
Okay, cool.
It's great.
Yeah.
What you shouldn't do is like put straight up vitamin C powder behind your teeth and hope that it's good, because this will definitely erode your enamel. Yeah. I don't know about the liposomal one. Is probably better from the pH, right?
Right.
Yep.
And what about hydrogen peroxide? I once had ages ago, I went to a clinic and someone said, oh, just swish around some hydrogen peroxide in your mouth. But isn't that terrible for you or no?
I mean, this is the one that dentists use to bleach teeth anyways. It's hydrogen peroxide, but a bit higher, probably a bit higher concentrated. For home use, I mean, you could do it from time to time because it will disinfect a little bit if you're sick. But I wouldn't do it for consistently. I would do coconut oil pulling rather than hydroxyperoxide. Or maybe you have oxygen, you have an ozone generator. That would be great.
Yes.
But yeah, coconut oil pulling would be a great solution to the Listerine. A healthy option for mouth. Yeah, don't do chemical mouthwash. It's designed to clean a toilet and a floor. No, it actually look it up. If you look for Listerine, it's initially designed to clean floor.
Oh
and
God.
then they use it for the mouth.
It is it's
Unbelievable.
the color of the toilet cleaner. You know when people clean toilets, there's that blue color. Maybe
Right.
Totally.
that's it. Oh, that's gross to think about.
You
So,
can definitely clean your toilet with it, no problem.
right, but not your teeth. So, so what about the ozone? How would you apply that? Because, you know, I'm very familiar with, you know, applying ozone different, but how would you apply that in the mouth if I was to use it?
So ozone, what we do in the clinic, we produce fresh ozonated water every single day. So for the ozone, you need a generator at home, or we have it in the clinic, obviously. So yeah,
My friend has one. But how
if
do
you
you?
have an ozone generator, you just Google how to ozonate water. You can also ozonate your olive oil. You can ozonate your
Oh,
cream for your face, which is also amazing. Yeah,
I have.
ozonated olive oil is very good for your gums because it sticks to it a little bit. Or ozonated coconut oil, amazing.
Yeah.
Oh,
Yeah.
amazing.
Just if you
Okay.
have a generator, ozonated
Yes.
water for
Okay.
rinsing, and then
Okay.
ozonated coconut oil for coconut oil pulling is amazing. I mean, ozone
Okay.
is one of the miracle molecules on
Oh,
that
it's
planet.
amazing. No,
We
it's
use
amazing.
we use it
I
like every single day, a ton in the mouth and everywhere.
Yeah.
Right. I used it before I went on this trip. Actually, I had the generator, and well, I don't want to be specific, but yeah, I used it before.
You use
Put it on
like
other areas.
Yeah,
Yeah.
you put it up there, and it works well. I can
oh,
go straight
rectal,
to
you
the
know,
face.
rectal ozone is
Yeah,
amazing.
yeah,
This
it's amazing.
I'm not a big fan of ozone intravenously. We have done it in the clinic millions of times, but actually rectal ozone is 95% the same, but without the oxidation that happens when you do it too much in your veins. So hemolysis, which happens from the veins,
Yeah.
doesn't happen if you do rectally. And rectally is like a lot of biohackers are fan of coffee enemas, right?
Yep. Yep.
And because they know it will help detox the liver, but ozone rectally is just gas, is way faster and is like 10x the coffee enema. It's just way more effective. And it's
That's amazing.
it's if you have the generator, it's basically for free.
Oh, it's incredible. My neighbor has the generator, so she's
How much-
got all this stuff in her home. So it's
what's the
incredible.
cost of a generator, of an ozone generator generally?
So it's hard oftentimes. I mean, probably you can find some online on Alibaba, whatever. I mean, we need to have like medical certified things.
Yeah.
They are always more expensive because we use it in the clinic. But for at-home use, probably guess around 400-500 euros, you can find something, or $400.
Mm-hmm.
Yeah.
And
that's amazing.
also there's a good one. There's a good one. I don't know if they sell it to patients, the company's name, and I'm not affiliated at all. I don't even have it yet, but I want to get it to my clinic for more rooms. It's called Promo Life. That is ozone generator for medical. And it's about $1,000. So it's actually for medical stuff, it's actually cheap.
Wow.
Or cheap.
Yeah, totally.
Because my ozone generator that I have in the clinic is more like $15,000.
Oh, wow.
Wow.
Yeah.
Wow. Oh, wow. Yeah, that's
It's
incredible.
obviously nothing you want to have at home. It's too expensive.
Right. Exactly. Yeah, ozone is incredible. It's one of those miracle gases, right?
Yeah, and if you look up the history of ozone, it's incredible. Like the first patents for ozone generators are actually from Nikola Tesla and Siemens. And that was 100 years before the first antibiotic. They already did their antimicrobial treatments with it.
Incredible.
And it's all there, just read it, but it's too cheap. Like it's a penny costing treatment. It's every virus. It's amazing.
So last night I was at a party in London and I was talking to this professor. He was professor in immunology and pathogen. Okay. And I said, so he's like, yeah, we're looking at the next virus, the next pandemic. And I said, okay, and how are you looking at solutions? And he's like, well, in the forms of vaccines or in the forms of, I'm like, okay, we're on different, okay, we're not on the same level. So I started saying, well, have you ever considered ozone? And I told him about the ozone out the butt. And I also told him about the EBO2. He never even heard of it.
Oh.
He never even heard of it. And I'm like, wow. And he's like, he was kind of laughing at me because he's a professor and I'm not. I'm a blonde Swede, right? So like, who she thinks she is. But seriously, but it's a lot to it, huh? I think it's amazing.
I mean, it's insane. But also during our last pandemic, there was papers coming out. There was one from China, penny costing treatment for COVID was ozone. But for example, today when my real biodentist from Canada was here, there was a big company for ozone generators for medicine that's from Canada called Longevity. They closed shop last year, I think. But before they closed, during COVID, they actually had on their webpage, we can sell it to every country but Canada, even though the company was from Canada. That's how crazy it was. Like Canada basically banned ozone. It's not allowed anymore.
That's
I
great.
mean, I don't know.
Because it works. Then you know it works. If they ban it, you know it works. That's why you want to use
Doing
it.
well.
Yeah.
It
Oh my
works
God.
and it's cheap. It's
Oh,
amazing.
yeah, it's
We
cheap.
use it
Yeah.
every single surgery. When I take out a root canal, we use ozone gas in the socket. If I take out your cavitation, use ozone in the socket. If I would take out your titanium implant, and I'm quite sure I already see it, how I remove your titanium implant, and I will use the ozone in the socket to clean and disinfect, because that's the perfect strategy. And it also activates your mitochondria to produce a little few enzymes and let's say antioxidants is a mild stressor. So more bleeding, and then glutathione, superoxide dismutase. It's just amazing stuff. And basically, like I said, the gas is kind of like for free.
Yeah.
Yeah.
What is the
Amazing.
what is the procedure like if I were to see you about like my wisdom teeth that were pulled? What kind of procedure? What would that look like?
The procedure in the clinic?
Yeah.
Oh, the surgery in itself?
Yeah,
Okay.
like what I would go in and you would like
Yeah,
make
I
sure
mean, you come in and then, like we discussed already, you have a lot of treatments around it, IVs, everything to prepare you. We draw blood before the surgery. And then it's just local anesthesia and a very, very gentle mid-crestal cut, like basically in the middle of your jawbone and flapping. So I don't produce any scar tissue. It's kind of like your body has a zipper where you can open it and close it and open and close it. So no vertical incisions that you usually do for wisdom tooth extraction. Just very gently opening it, removing the dead bone with piezo surgery, which is a very minimal invasive type of surgery. Is not ultrasound, that's not correct, but kind of ultrasound surgery. And then if it's all clean, so we remove the dead bone, the fatty tissue, and then if that is bleeding and nicely and clean, then we use a ton of ozone in the cavitation. And if that is done, we basically put the membranes we made out of your own blood, called PRF membranes. It's kind of like PRP, but in a different form. We place it in the socket or in the cavitation, and then just stitch it up. And because you are in a healing mode, because you were prepared with the right nutrition, the bone healing protocol, then you know exactly what to do for the next 3 to 4 months, because that's how long it takes for your body to build bone, and that's it.
Amazing.
That's very important. But yeah, it's deep healing. There's so many women and men out there that cry during surgery, not because of pain, but because it's a relief for the sympathetic system. They go into parasympathetic. We can measure that in real time. It's this. If I talk about it, it's usually like, oh man, this a dentist talking about it. But you can see it on my Instagram. I have a couple of pages with testimonies that tell you on the day after surgery, guys, you won't believe it, but I have no more joint issues, and the surgery was only yesterday. Stuff like that. Yeah.
Wow.
I have no more skin eczema. I'm not depressed anymore. I have no more thyroid issues. And of course, then this becomes a fulfilling thing. Yeah. The technical side of things is achieving. It's a craft. You can master this. It's kind of like an art if you do it for thousands of times like I did. But then if your patient tells you, I had seen 29 doctors, there was always a problem. No one could help me on the next level. And now I'm finally there, only 2 days after surgery. I mean, you want to teach it, right?
Oh, wow.
Of course.
That's incredible.
It is. But you have to feel it for yourself. That's why I also don't do general anesthesia, because I want you to be present in surgery and feel not the mouth, but everything downwards. Because I'm not working on a symptom, right? You don't have any problem. But I work on a source. And if I remove the source, your body goes in healing mode by itself. I'm not healing. I'm just helping your body heal.
Yep. Yep. Just moving it. That's incredible.
Putting it into parasympathetic.
That, oh my gosh, I'm just thinking about all my clients that I would want to send to you. So what do I do? What do you do about, like, who do we send people to? Because I can't send people to Germany necessarily from Florida, but like what?
There are a lot of people coming from Florida.
Okay.
But like I said, I have a directory to the ones that I have completely trained. They're called the real biodentists.
Yeah. Okay. The real biodentists.
And I mean, I can send you probably links for the show notes, right?
Yep. Yep.
So if you can follow up with an email, I'll send you the links to whatever you're interested in, the directory, the supplements, my clinic, obviously, everything you want. And then patients can decide for themselves. Some actually want to fly out to us in Germany. So we have a fast track answer basically for all the DMs, which says, this is our clinic, you can go see us, or here's the growing list of dentists I've trained. And there is one, and there is a few actually. No, there's at least one very good one, Maya in Florida.
Oh, great.
Where is she in Florida?
Maya is in Florida, and she also has a biohacking center.
But where is she in Florida? Do you know, East Coast or West Coast?
Oh, now I'm blanking.
That's all right. That's all right. We look in the notes after. We look in the links.
Yeah. Maya is I can definitely connect you also on WhatsApp to Maya if you want.
That's amazing. That's amazing.
Yeah. For example, what we also often do is like I do the surgeries, and then the rest of it, which is called the prosthetics, the crowns on top, the aesthetic side of things, the other one do.
Yeah.
Or for example, a train, like one of my biodentists flies into me for a new surgery with their patient, just also to learn more and observe, and then takes over back in Florida or back in Canada or wherever. Like, this is how I try to teach it all, to give it back or like give it out. It's not for me. I mean, I could just say, okay, I'm good, my clinic works, ciao. But I want to teach. I want to get to at least 1,000 real biodentists within the next 5 years, and at least 300 of them need to be level 3 certified, meaning they can teach themselves.
Oh, that's amazing.
That's amazing. Right? Amazing. And then it's just a ripple effect. Then, you know, you get known more and more, spread all over.
I mean, because of my US trip lately, we had the directory within 1 month. We had over 100,000 patient views on that directory. So it wasn't, we didn't build it for that. We didn't know that so it broke down for a day because it was too for the page.
That's a good problem.
This is only just the beginning. So dentists that are kind of listening to this right now, this is the next level. It's the dental evolution. So you don't want to miss out. Real biodentistry 3.0 certification. I sent you the link definitely for the show notes.
Absolutely.
There will be dentists resonating with this, and then
I can't wait to tell the ones, and you know, we'll see what their response is, if they're open or if they're not. But I think I hope so, because there's so many people that they can help this way. You know,
100. It is a mindset change for the dentist. But the good thing is we don't take the technical side of things away. We just upgrade this, and they have to learn a bit more about the whole body, but also can work perfectly together with you. Yeah, it's collaboration. I mean, I have nutritionists and people in my staff too, or myself included. Like,
what is what is there anything specific about your bone healing diet that you give people? Is it just gluten-free, dairy-free kind of?
So first of all, it's all about the nutrition. That's I call it the food design concept.
Yeah.
Where it's initially an elimination diet kind of. So there's a red chart for patients, very streamlined what they shouldn't eat. Gluten obviously is off.
Yeah.
No dairy for the beginning, no sugar, no refined vegetable oils. And then the green chart is basically macronutrient based, enough protein, healthy carbs, healthy fats. Yep. Level 3 is a bit more individualized, meaning I can go see your HRV and see what energy nutrients you would need. Mm-hmm. But if this foundation is set, like 1 gram per kilogram, 1 gram per pound of body weight would be protein, all the details for healing. But if this is groundwork, then the bone healing protocol, that is supplementation mainly. Yeah. Where we have in the bone healing protocol, we have about 20,000 IUs of vitamin D3 per day, including all the necessary cofactors, vitamin K2, magnesium, bone, zinc, omega-3s. It's all calling it bone healing protocol these days is actually wrong, because it's so much more. It's more like a complete health matrix protocol. There's all the 4R protocols from functional medicine in it too. Yeah. But then I know they heal. And I'm not a fan, even though I have a supplement company, I'm not a fan of using supplements to compensate the wrong lifestyle. It's all about supplementing it. And then obviously supplements are not controlled. And this is why I'm that nerd who creates supplements that are just, it's basically the capsule is a prebiotic and the rest is we don't even do steroids and stuff for over a decade, which was unheard of back then, at least in Europe. All the companies told me it's not possible. It's getting better now. But 10 years ago, forget it. Like I was just way in this. I'm just interested in it.
You're never quite sure what you're going to get with a supplement unless it's a third-party tested kind of, because otherwise
we still to this day third-party test everything. Like all our chlorellas, all our omega-3s go through third-party testing for pollutants and all these things. Yep. I don't trust the process. It's food. It's never going to be controlled. Therefore, I started the company because I wanted the best quality for my chronic unhealthy patients back then.
Yeah.
And nowadays, I don't have only super sick patients. Now I have patients like you too, people that want to have the extra edge. So it's, but in a sense, it's still the outside realm. So the most extreme disease, or the most extreme when it comes to optimization, we need a 10 out of 10 treatment to get to the next level on both sides. In the middle, you maybe can play around a little bit, but on the edges, I have a lot of athletes, a lot of high performers, entrepreneurs, biohackers, health optimization people too.
Wow.
And they need the same level of treatment. Me too.
Yeah.
It's amazing. I love every single day.
Oh, we're so
And
excited.
I'm there to learn more, like, and connect with you guys and other people that are there to help other people.
You are incredible.
Thanks.
You're incredible. This has been such a treat. I mean, I love it.
We're so
You can
excited to
just
have
see,
you.
yeah, we can just see your passion, obviously. We can see your passion and that you're real about this and you really genuinely want to help people. It's very clear in your voice, in your face, and it's so wonderful and refreshing. And, you know, you can just go on forever about this.
Yeah.
I can.
I have a dinner I got to go to, but I would love to continue.
Waiting.
Yeah.
Yes, yeah. Kids are waiting, I'm sure, and your wife. So this is such a wonderful, wonderful treat, Dr. Dome. Thank you so much. And where can our listeners find you?
Thank you for having me, guys. It's really fun. The easiest is Instagram or Dr. Dome Official. So Instagram is Dr. Dome 1, and the webpage would be Dr. Dome Official. So Dome is a German abbreviation of Dominik.
Mm-hmm.
So in English, we would probably say Dom, but Dr. D-O-M-E Official. You find all my podcasts, you find my clinic, my book, the Instagram again, the YouTube channel, everything. So both are easy. But I send you all the links for the show notes. Just follow up with an email.
Yeah.
And then we can also exchange, and you can send me your panoramic on the easy way, because it's hard to get into the clinic. But if you know me, it's a bit easier.
Amazing.
You're the best. This is so fabulous. Can't wait to meet you in person.
Yeah, me too. It's going to be amazing. Yeah.
Very fun.
Very cool.
Thank you so much.
So grateful for you being here. Have a great night. Enjoy your family.
Thank you, guys. Enjoy your day.
Bye now. Bye-bye.